Meeting's live.
Appropriations called to order. Roll call.
Senator French.
Here.
Senator Garou.
Here.
Senator Larson.
Here.
And Co-Chairman Driscoll.
Here.
Mr. Chairman, you have a quorum.
Thank you. First bill up will be House Bill 122, Wyoming Rural Health Transformation Program. I don't know who we have here to present even. Anybody? There we go. Now we've got an all-star team coming up. Now, here's the experts. Welcome, welcome.
Thank you, Mr. Chairman, members of the committee, Stephen Johansson, Director for the Wyoming Department of Health. Just want to reiterate for the record, we were called the all-star team, so let's make sure that's in the LSO minutes. Appreciate the opportunity to give you an overview of House Bill 122, Rural Health Transformation Program. Mr. Chairman, members of the committee, this was thoroughly worked in the Joint Appropriations Committee, passed unanimously in the House, both out of committee and on the floor. Just a broad overview, if I may, Mr. Chairman. We don't have to hit all the details, but certainly willing to answer any questions you have. Page 5, if you work through the bill, establishes the Rural Health Transformation Advisory Committee. Page 7 through 10 establish the Wyoming Rural Health Transformation Perpetuity Fund, and I'll go into each of these areas in a little bit more detail. Page 10 through 11 establishes the program itself, and pages 11 through 22 goes into more detail about the rural health transformation programs that are in Wyoming's approved plan, and those are in two categories. Perpetuity funded programming, namely hospital, critical access hospital financing, EMS financing and sustainability, and workforce, nurses, EMTs, behavioral health, and physicians. Those are perpetuity funded programs, and then there's a smaller subsection of time-limited grant programs that are also in our approved application, and those pages of the bill, 11 through 22, just provide the authorization for the department to implement those programs that were in the approved plan. Mr. Chairman, page 22 is important. That was something the JAC discussed, that basically provides the advisory committee ability to provide feedback to the department and weigh in on spending decisions, as well as notice provided to the legislature on spending out of the program that is in excess of $500,000. So you'll recall from your discussions, that was a preference of the committee, something we're certainly okay with. For the legislature to have notice when those larger expenditures or program elements are being implemented. And finally, page 23 through 25 establishes recipient reporting. A lot of that mirrors some of the federal guidance and requirements that are already established in the program, but also adds a few elements for more state-specific reporting that we would do to the legislature or to various entities, committees, et cetera, on the program. And last, the appropriation is on page 26 through 27, as well as some boilerplate in the final pages of the bill. Mr. Chairman, that's a real down and dirty overview of the bill, but if I can back up and just talk about the process a little bit, because this is a big opportunity for Wyoming and something that we've been working on pretty heavily since the fall. We were directed after this opportunity we became aware of it from the big beautiful bill from HR 1 that was signed on July 4th by President Trump. We saw CMS guidance on the Rural Health Transformation Program in early September. We were directed, all states were directed if they wanted to submit an application by November 5th. We did so on November 4th. What preceded that application submission was a very lengthy, as best we could, a public engagement process in small rural towns across Wyoming to do a couple of things. One, present what the opportunity was, but more importantly, solicit feedback and engagement on what the challenges were, what the problems were that this funding, this opportunity could help address. Those town hall meetings across your communities helped us inform a statewide survey that we issued to further refine those priorities. We received about 1,300 responses, which was pretty good given the timing to that statewide survey. And the takeaways for me as your health director, and certainly working in conjunction with Governor Gordon and his staff, was that what we heard from the people of Wyoming was not a wish list of extravagant spending projects with the funding that could come down from the feds, but really the direction and the request to sustain and improve the basics. A hospital that is financially sustainable, that has an emergency department, OB, labor and delivery services somewhere nearby in a region, an EMS or an ambulance system that is financially sustainable, that shows up when you call 911, workforce, CNAs, nurses, the things that we struggle with, especially in our rural communities, and operating 5 Department of Health facilities in rural communities. I know that struggle too. Access to workforce was something we heard resoundingly clear from the public, that you can have all the infrastructure that you want, but if you don't have the people to deliver the services, you will struggle. And finally, some access to primary care, nearby, telehealth, et cetera. So again, Mr. Chairman, members of the committee, my broad takeaway from our public engagement and how we designed our application to the federal government was not around a wish list of extravagant items, but in a innovative proposal to sustain basic care and sustain our basic functions of the health system throughout our communities. And I was pleased with the product that we put forward to the federal government because we really designed that bottom up. And in our discussions at JAC going back to December and into January, we had these robust discussions of how that was developed. And we very much appreciate the support that we have felt from the legislature. You just look at the digest of this bill. As much debate is going on in this chamber over the past month, it's nice to see that there's some agreement that we have an opportunity to come together and do something pretty meaningful and hopefully generational improvements for the state of Wyoming. Mr. Chairman, finally, the process going forward and how it relates to this bill. As I mentioned, we received an approval, a notice of award from the federal government, Centers for Medicare and Medicaid Services, CMS, on December 29th. And the next step for all states that had a notice of award was to go through what's called a revised budget process. And that makes sense because every state received varying amounts of money. So the direction is to revise your budget based on your notice of award. And that involves discussions, negotiations, deliberations with the federal administration, with CMS on various components of allowable and not allowable costs. We are in that process right now. And so I can report to you today, we've been pleased with the engagement from CMS. But based on what Wyoming has designed into this plan, what we believe our Appropriations Committee and Legislature supports, we are negotiating a few very important components of this program to ensure that we deliver what the intent of this application and this proposal was, and especially what this body has to this point supported. I wish I could tell you that process was final right now, but we are still in those negotiations and discussions. And as I mentioned a couple of weeks ago on the House side, we intend to update this body, your committees, as soon as possible. These can evolve by the day of those negotiations. And timing is an issue here because you have a week and a half left of this session. And so should there be developments that require changes to this bill, we will certainly bring those to you. But right now, as it stands, we believe, and the Department of Health would recommend moving this bill forward. As it came out of committee and as it came out of the House, we believe it's in good shape, it's clean, it's clear. There's some complexity here, as you can see. There's a lot of things that are established, but we believe it not only gives us the tools and the authorities we need to implement this program to fidelity of what was designed into Wyoming's application, but also shows and communicates that our decision makers, both in the executive and legislative branches, are on the same page with the intent of Wyoming implementing this program. Mr. Chairman, the last thing I'll mention, we are not the only state that's in that negotiation period, so I thought you might want some updates from nationwide. My understanding as of yesterday is approximately 20, maybe a few more, 20, 25 states have signed the cooperative agreement with CMS, have their budget revision approved, and about half, more than half of the states are kind of in the position we are, still negotiating, discussing various, smaller or larger components of their proposals before they ultimately sign off and have those funds unrestricted by the federal government. Again, in the coming days, as you guys wrap up your session, we will do our best to update you accordingly, but believe at this current time that the bill's in good shape, and if it's this committee's pleasure to move it forward. Mr. Chairman, happy to stand for any questions.
Questions, Mr. Johnson? Senator Drew.
Thank you, Mr. Chairman. Thank you. Thanks for being here. I've been told that the perpetuity fund is one of the points of contention.
Right.
That hasn't been fully vetted out. And while I know you can't, the affairs of men are impossible to predict, and the affairs of the administration are even worse. So I won't even go there as far as how this particular idea turns out. But as if you contemplated or talked about another way of looking at the same thing on a perpetuity thing, in other words, if they said no to this, would there be a way in a different plan to put the money out, say to hospitals or into the entities, and let them come up with their own plan? And so in other words, have that be the plan. If you don't like us holding it, federal government holding it as a perpetuity plan, that we fan it out or across the enterprise and say, these in block grants or whatever, and say, you have to take this money and hold it for a certain period of time and do that. Is that another way of looking at the same thing? I'm just trying to game that part out.
Mr. Chairman, Senator Guru, it's a really good question. So yes, the perpetuity fund is something that we're in ongoing discussions with CMS about its ability to be an allowed cost or an allowed method within this program. I'm hopeful and optimistic we can get there. However, we have discussed alternatives, and one of the sticking points that we are holding pretty firm on is, as you can see throughout the proposal, and really the bulk of our proposal, half of our award was allocated really for two important purposes. One is to actually provide sustainable relief to our critical access, our rural and frontier hospitals through reform, basically offsetting fixed cost of really expensive care that's hard to maintain. Emergency departments, OB, labor and delivery, EMS, ambulances are expensive. We don't have the volume to support that in terms of billing the various payers for revenue. This innovative proposal was a way to do something differently, not just request money and give out block grants to help balance sheets, but do it in exchange for meaningful transformation of the system. Those two components, the perpetuity fund, but even if we needed to design an alternative, our sticking point is because we want this to actually transform and sustain care, we want to make sure that those dollars can be delivered to those providers to ensure that that care gets maintained with what we heard from our people, from our decision makers through the process. And that's something that, again, we're in ongoing discussions about, but something that I'm proud that Wyoming, the governor, your Department of Health, we're holding on that because of course to answer your question directly, of course there's alternative models that can be explored. There's technical details, limitations that we certainly are open to and want to be receptive to those. But if that direction does not result in the financing that you all anticipated coming to the state actually being delivered on the ground to our providers, that not only stabilizes, critical situations and imminent closures that could be before them now, but also results in that transformation and sustainability of the service in out years beyond this grant program. That's something that we're negotiating and discussing very hard with the federal government.
Thank you.
Senator French.
Thank you, Mr. Chairman. Director, along the lines of the senator, would you expand a little more if that perpetuity fund is allowed? I think, and it's been a month and a half since we talked about it, so correct me if I'm wrong. I think it was mentioned that might stretch it out 20 years. And if you had discussed that and what things could we do for that 20-year timeframe? Thank you.
Mr. Chairman, through you, Senator French, another good question. So I think the duration of that perpetuity would be TBD, but we modeled it out at least 20 to 30 years, really until it would run out. And the reasoning behind that is, especially with your hospitals and your EMS systems, which we really targeted with this program, with this application, having that duration of not only more conservative investment up front, but predictable revenue going forward in exchange for doing this business a little bit differently on the state side. We know that those services that we're talking about, critical access hospital services, EMS, ambulance services, are extremely expensive. And the multi-payer system, Medicare, Medicaid, commercial payers, there's just not enough volume to support that infrastructure, which results in you all seeing bills, legislative discussions, debates on what's the state's role in financing that. We've made a proposal that allows us to offset those high fixed costs in exchange for meaningful reforms, things like regionalization, things like consolidated billing or improved billing to generate more revenue, things of that nature. And I think the time period that you're mentioning, Senator French, whether that's 20, 30, 40, or more years, allows the state the opportunity to have that predictability on what's being requested in exchange for these funds. We believe that true system transformation with the things that are articulated in the plan are not possible if the financing only, or the perception is the financing only lasts for 5 years. CARES Act, ARPA, round 2, that we are left in a situation 5 or 6 years from now where you all and the executive branch are going, okay, now what do we do? Is it state appropriations? Is it asking Congress for more money? That's the fundamental philosophical point that we're trying to make with this, is we believe that we can accrue those benefits over a longer period of time through more conservative investment up front, but with that predictability for our communities and our providers, that fixed cost offset revenue stream is coming for a longer period of time.
Okay, thank you very much. Appreciate it. Further comments? Do we have any government agencies more? Public comment? See none. Do we have anything online? No, sir. Public comment is closed. Committee? It's your pleasure. Moved second. Any amendments or discussion? Question. Roll call.
Roll call vote on House Bill 0122 engrossed. Senator French?
Aye.
Senator Garou?
Aye.
Senator Larson?
Aye.
Co-Chairman Driscoll?
Aye.
Mr. Chairman, you have 4 ayes, 1 excused. Do pass.
Senator Grew, you'll pack it on the floor. Thank you. Yes, I don't have the agenda here. We do. Omnibus water bill planning, 87. We've got the experts there. You have the floor.
Thank you, Mr. Chairman, members of the committee. Good afternoon. Jason Mead, Director of the Water Development Office. So with all of your experience on the Select Water Committee, you guys are well aware of the process we go through to get to the point where we are with these planning studies that are in the bill here, and also aware of the fact that the appropriations come from one of the water development accounts, and those are all funded through mineral severance taxes. So I'm going to jump to just inside the front cover of our 3-ring notebook here to the blue sheet and run through that real quick for you. The first block of projects that we have are our level 1 reconnaissance studies in account 1, or new development. We've got 8 municipal master plans and our UW water research projects, and those come to a total of $2,186,997. Our second block of projects there, we have the Bedford and Turnerville Regional Supply, which is a level 2 project under account 1 for $327,000. Then we have a master plan for the Shoshone Irrigation District out of our account 2 rehab account for $470,000. We've got our 2 projects, level 2 projects in the account 2, Casper, Alcova, and Wheatland for a total of $528,000. We've got our biannual budget for the UW Office of Water Programs, who administers our water research projects for $175,000, and then one amendment for the Millwood River storage to account for additional coordination and designs, plans, specs for some of these landowner mitigation projects and finish up the design on the dam itself. So I would stand for any questions. Thank you.
Roll call vote for,
Can I comment? Mr. Chairman, I am on the Shoshone Irrigation District as part of that landowner there, but I'm still going to vote on the bill. I think I can do that.
I think you're in line. Roll call.
roll call vote for House Bill 87. Senator French? Senator Garou? Senator Larson?
Aye.
And Co-Chairman Driscoll.
Aye. Larson or French, who wants to carry it?
Mr. Chairman, you have 4
Larson.
ayes, 1 excused, do pass.
Larson, you'll carry it on the floor. Okay, we're on House Bill 78, Forest Health Grant Program. I don't think anybody's here to present it. Hicks bill, do we want to just work through it? It's a pretty simple bill, and it came out of our committee, so. When do you want to walk through it, or do we want to? I'm going to make an amendment to it before we're done, so. What's that? Just what? Okay. All right, you're leaving a vote? Okay. So, grant program, state forestry creates forest grant programs specifying dates, approved grants, duties of the state forester. This was, Senator Hicks brought this to Select Water, if you folks remember it. Basically what this does is goes in and creates a program, and the key tenets of it is bottom page 2, enhancement of water yield and quality, reduction of the risk of catastrophic wildfire damage, increased production of forest products, improvement of habitat conditions for wildlife and livestock, and any other projects beneficial to forest health substantially beneficial to the interest of the state, has a public purpose determined by the state forester, allows grants under the program that's used on federal land, says can't pay more than half of the eligible costs. They can take in-kind and other end of it to do the match on it. No grants made on page 4, no grants are made under it without the written opinion of the Attorney General. Make sure we cross all our Ts and dot the Is. Then at middle of page 4 is the creation of the grant program account. Puts in it, funds that go into it is people can grant, give, transfer, bequest. On top of it, funds in the account should be vested, provided by law. Any funds remaining at the end of any fiscal year don't lapse, they stay in the fund. Accrued interest stays within the fund and runs through it. On to page 5. State Forester annually reports to the Ag Committee and on where it's at by September 1, what grants they've given, including amounts. This would be very similar to what you see out of Bob Budd's office. Section G, no forest grants under this section be approved after July 1, 2030. Any obligated funds, forest grant shall, and then it goes on to, it says if they're not state funds, be returned without interest or other earnings to the person. Goes on through it, but basically what it is, it's got a 2030 sunset on it. I'm guessing it works, it'll last longer. Going to the page 6, the last page says source of the funds or state funds, they revert to the general fund or other state fund. Section 2, this is where they appropriate the money into the account, $3 million general fund to start this program for purpose of implementing this act and making grants by this act. Not transfer, expended any other purpose, boilerplate, goes on through, and it's effective July 1. So that's the bill. Any questions, committee? Senator Larson? Senator Grew is not here. Any testimony from the public? Seeing none. Anyone online? No one online. Committee, what's your pleasure?
Move the bill.
Moved and seconded. I have an amendment to it, or I'm going to try to, which would be to move the funding on section 2 on page 6 to move it from 3 million to 5 million. It'd be a $2 million increase on it.
I'm sorry, say that again.
So on page 6, section 2 on line 5 and 6, we funded this at $3 million. I'm going to move an amendment to try to move it to 5 million. Do I have a second on it?
Can I ask you a question first?
Absolutely, that's where we're at.
Why the extra 2 million? What do you think that will do?
So I think we've been really effective with these forest health programs. They've worked, and I think that the 3 million probably, when you start going statewide, doesn't really go that far. I use, for an example, the pine beetle programs we did. And, we started it with $1 million, then went to 2, and then went to 10 on it. And, these forest health projects tend to be fairly expensive to do, and they generate quite a little bit of income back into our communities. I know for us, the pine beetle program created quite a bit of employment and quite a bit of economic activity. And so for me, it's just getting that thing jump-started to a little bit higher level. If we were broke, I probably wouldn't bring it, but we're at a point now that I think it's appropriate.
Mr. Chairman, and these funds are usually 50-50 with the federal government, is that not necessarily, but?
Senator Larson, yeah, I think very often they're 50-50 with the federal government, but some of them may be with cities and towns, it's basically a health deal. So it could be some different areas, this is the way this works. I don't think it's all has to be, and I hope I'm not right on it, but or wrong. I think that the way I read it, it can come from a lot of different places. It's forest health money, it's just got to be matched. And so
Yes.
you could have it come out of, if it's on federal ground, it's got some specs on it, but some of it may be on state ground. It might be state lands doing it, state parks doing it, which they did in the pine beetle program. They applied for match funds. I know Kirk Rowdy did some. They did some here in the city of Cheyenne. So, further questions?
Yeah, I'll second it.
Seconded. All in favor of the motion, say aye.
Aye.
Those opposed, no. Motion's passed. Back on the bill.
Question?
Question on the bill. Roll call.
Roll call vote on House Bill 78 as amended. Senator French?
Aye.
Senator Larson?
Aye.
And Co-Chairman Driscoll?
Aye.
Mr. Chairman, you have 3 ayes, 2 excused on a do pass amended bill.
Very good. And I think that runs us through. I think the next deal is, I think we're up to interim topics, maybe on tomorrow or the next day, just so the public knows what's there. Is that correct?
That's correct. Your interim topics meeting is next week on Wednesday at noon.
Next Wednesday, for anyone out there, if you've got interim topics, you can actually submit them to any of us. We're happy to take them. So thank you much. We're adjourned.